So we're going to get started so we can utilize all the time for the speaker. So welcome to the College of Public Health and Human Sciences research seminar. This is the last one of our term, and perhaps we saved the best to last. I don't know. Anyway, hi, yeah, lots of pressure up here. So anyway, I am delighted you are here in person. We have a nice group here in person, and I welcome all of you who are coming in via Zoom. And I think will tell you more about, if you're coming in via Zoom, of how to ask your questions. So let me also introduce Will Massey. Will is an associate professor in the kinesiology program. He is also I believe, the graduate program director for kinesiology. Some would say that. I know that's true. And he has very graciously agreed to introduce our speaker and to moderate our session. So let's just get going. And so I'm going to hand this over to you, Will.
All right. Thanks, everyone, for being here in person and for those online. I'm super excited to introduce Dr. Julie McCleery, who comes to us from the University of Washington Center for Leadership in Athletics. Julie has a bachelor's degree from Georgetown, a master's of education and education policy from Harvard, and then a PhD in educational policy from the University of Washington. Another fun fact, she's also currently a law student at the University of Washington in her spare time. She has over 25 years experience as an educator, a coach, an advocate, a lot of that work in the youth sport realm. And her research has springboarded the King County Play Equity Coalition, which you'll hear a lot about, but a grassroots coalition of, I believe, over 100 members working to advance policy, legislation, practice in the youth sport realm. As part of that work, Julie was the lead, and I would argue the brain and the big push behind a bill that recently passed in Washington State to mandate a minimum of 30 minutes of recess for children in every elementary school. So might hear a little bit more about that as well. So with that said, I will turn it over. And thanks for being here.
Proud of you.
Get this set up. All right. Is that good? You hear me? Okay. Hi, everyone. Thanks for having me. Between Will's introduction and the talk I had with his graduate students, I feel like you might have learned already all there is to know about what I'm up to. Now, hopefully I can fill in a little bit more of the story, which the story I'm telling is really one of research to practice. And my role is the director of research practice partnerships at the University of Washington Center for Leadership in Athletics. And so I stand very much at that intersection. And so I just want to talk a little bit about that process too. And it's going to be pretty much a chronological story of how a research project that I led called the State of Play, Seattle, King County, led to, as Will said, the King County Play Equity Coalition, and then how the work of the King County Play Equity Coalition led to the passage of the recess bill, with a few other things sprinkled in. But just for hopefully through the course of that chronological story, I'm going to talk a little bit about, what I think makes this kind of research to practice bridge work, and some of the important sort of themes and values that are a part of it, in that it has been iterative. So we're sort of constantly going from research to practice and back again. It's been very community informed and led, interdisciplinary and adaptive, and very flexible, which comes along with both community informed work, interdisciplinary work, and collaborative work, which this also is. So hopefully you'll hear those pieces in the story as well. Just a little bit more context about me. The Center for Leadership in Athletics is within the College of Education. at the University of Washington, but it's kind of a standalone center, a self-contained center. And we run a graduate program in athletic administration. So we offer a master's degree in education that's focused on either coaching or athletic administration. So I teach in that program, also teach undergraduate courses in similar topics. And then my research essentially fuels those graduate programs, or vice versa. Financially, they fuel me, and then, I fuel them with my research. And I came into it with an education policy background, but with also a very long background in sports myself, and as a coach and as a youth sports advocate, as Will said. One of the important pieces, though, I think, is the idea that I'm not a tenure track faculty. And so we talked about this a little bit this morning, but like the incentives, I don't have to sort of follow the same incentives that many of you probably have to follow. And so it gives me a little bit more latitude to do applied work. And that has its pitfalls, right? I don't have much of a path in the university, but then again, I'm allowed to work on both sides and do the research work and do the community work. But so that's, I think, an important context to understand how I may be able to kind of be firmly planted in both places. Just a little bit about King County. I mean, it's close enough that maybe some of you know a little bit about King County. It's where Seattle is, but it's a relatively diverse county. A lot of what I'm talking about today is about King County. So I wanted you to know kind of some of the context there. There's about 450,000 youth under 18, which is our population that the coalition is kind of looking at and thinking about. I think one of the biggest sort of demographic pieces of information is that more than 25% of the population there is born outside of the U.S., and it makes it the third, like among all counties, like has the third greatest population of foreign-born residents in the United States. And so a lot of our work has been around immigrant, newcomer, and refugee youth, because they are the group that the research has found and that we know anecdotally are sort of the most disenfranchised from physical activity in our county and in a lot of places in the U.S. Okay, so the starting point here is a state of play. And I know some people in the room have heard of the Aspen Institute's Project Play, but like, can anyone, if you've heard of Project Play, could you just raise your hand? We got a few here. Okay. So just for context, you all know the Aspen Institute's a think tank. It works across a broad range of topical areas, content areas, and it has a sport and society program. It's called Project Play, and it is focused on nationally increasing rates of youth physical activity, particularly increasing access to youth sports. And it's been around for about 10 years. And early on, when they started up, they started doing these regional state of plays. I never know if it's like state of plays or states of play. I'm going to go with states of play. So they had done about 5 at the time I learned about them: Baltimore, Detroit, Mobile County, Alabama, a few New York, Harlem in particular, a few of these. And I was doing work on coaching research, and I enjoyed that work, and also thought my work both as a coach and in coaching research just was too narrow, in that we could train coaches to be great coaches, and they were still often in systems that weren't allowing them to really support kids in the way the kids needed to be supported. And so I wanted to understand more about the full youth sports ecosystem. And that's what these reports are, these really like broad landscape analyses of a region to understand what the barriers and strengths are of a particular region when it comes to youth physical activity. So I was able to, with, about a year and a half of ramp up, be able to gather some community partners to commit to funding this, and launched into the research related to this as the PI. So I would say that the framework that informed this work that has helped push it into collective action on the other side are these 3 things: that it was very mixed methods, that it was process oriented, and that it was really power conscious. And I wish I could say like, I had this framework in my mind when I went into it. It wasn't necessarily the case. I was thinking about these things, but as I look back to what maybe made it take root as a research project and a report in the way that it did, I think these were three of the core pieces. So I'm going to just talk about those a little bit. So firstly, in looking at the methods, I think these are most of the methods here: surveys, interviews, focus groups, GIS mapping, and policy analysis. So very, very mixed methods. The data that we lean on the most, have leaned on the most, I would say, is the youth survey, which started as a stratified random sample of schools in King County. But unfortunately, because schools are so hard to work in and we didn't get permission everywhere, it turned out being it was still stratified, though maybe it was not really a random sample in the end. However, it was representative, and we were able to compare our results to a Washington State survey that's given every 2 years. I don't know if you have that here in Oregon, but the Washington Healthy Youth Survey, something that kids all over the state take. And so we were able to compare. We had like 4 questions that were the same, and we were able to learn from that it was a representative sample, and the metrics were very similar across the 2 surveys. So the youth survey, we did a parent survey that wasn't very representative and didn't end up using it, a coach survey, a series of interviews and focus groups, as well as the policy analysis, which I'll come back to a little bit later. So the mixed methods, of course, you all are researchers, so I don't need to spend too much time on this part, but like it allowed us to contextualize what we learned, right, from the youth survey, not just like who has access and who doesn't have access, but why don't they have access? Like, what are the specific barriers, right? So we were able to, the report is structured so that there are 40 findings. What's that mean? Okay. These are just a few of the findings. I'm not going to sort of dive into these. Anybody who's sort of worked in the youth sports or physical activity realm, these will look very familiar, right? There's the barriers of cost, the barriers of transportation. In our area, I don't know if that's true here, but like just a real lack of access to facility space. Where one of the population in Seattle and King County is just booming, and there's just not enough places to play. So, by doing the interviews along with the surveys, we were able to understand like more specifically what the barriers were, and therefore to construct together the solutions. And the group, I know this is a bit of a messy slide, but the group that constructed the solutions as part of the report was this advisory board that you see here. So this is part of the process oriented. The whole research project, beginning to end, was done with a community advisory board of 30 folks. And so everything that we did from, the recruitment, the sampling, creating the questions, looking at the data together and writing it up and telling the story and saying what solutions we wanted was done through that advisory board. And that turns out to be a really critical piece of why we were able to be actionable on the other end. We even use the notes from the advisory board meetings as like a qualitative piece of data and coded those along with the interviews and focus groups as well. In terms of the power consciousness, I would say that I know that I give this talk sometimes more in the sports space, where sometimes folks aren't always as conscious of these things. I'm sure this group is way more conscious of this, but like a lot of times in the state of plays, for example, we find folks who aren't researchers doing non-representative research and making claims about what they know about youth sports and physical activity in ways that maybe aren't as helpful. So, one of the things that I try to talk to those folks about is just like, if you're not representative, you really need to moderate your claims, because it doesn't do anyone any good to make claims that actually aren't truly representative of the population. So, I already talked about using a community-led, community-informed process. We value people's time to the extent that we could through through incentives, but even more so by being able to tell people what we were going to do with the data and then doing it. And in our very first focus group, sorry for those for the story already, but in our very first focus group was with the Congolese Integration Network, which is a social service agency in South King County. And we had a group of 20 parents and a translator, and we got into the focus group questions, and about 10 minutes in, a woman raised her hand and said, "You people always come and talk to us and ask us questions, and we tell you what the problems are and you don't do anything about it." Right? And we were just like, yep, I can see where that's probably the case. And you people meant anyone from the UW, from the city, from any of the places that are trying to understand what the issues are, but understanding what the issues are that wasn't enough, and it wasn't getting back to them, and they were not seeing resolution on any of the issues that they were talking to people about. And so that was just sort of a moment for me to really lean into the idea that something needed to come from this research, and that how could I step into this space and think about these findings and solutions and not actually do anything about it. So I felt like that was a really a motivator for me, and kind of changed the approach to the research from there. Other things that we were able to do because of the mixed methods, really contextualize the data. A lot of our partners, tell stories about the ways in which just presentations of quantitative data about gaps, like between, youth of color and white youth accessing sports, or youth who speak English at home, and don't just reinforce stereotypes, and actually can do more harm than good if they're not contextualized. So instead of saying that only 11% of immigrant girls get the recommended amount of daily physical activity, we're able to say something like, because programs are not culturally and linguistically attuned to their needs, immigrant girls, have less access to opportunities to be physically active. And so that contextualized framing to our partners and those who are engaged in the research, it felt like it represented their experiences way more than the quantitative data ever could. And therefore, we were able to use it to construct these solutions together, to guide and inform policy, and to use it for emergent issues, which I think is a huge one, which I'll tell you a little bit about. But first, I want to just say how much this co-construction was just really fascinating, in that this statistic of only 19% of youth in King County getting the CDC's 60 minutes was like the headline. This is what all the papers picked up. That's what everybody wanted to talk about. That was the one thing in our study that was already known. That the Washington Healthy Youth Survey had that number. It had been that number for years, but no one had ever. That was like, oh, you over there did this research that's telling us that it's 19%. It didn't have any meaning to anybody. And then suddenly, when people saw how that research was gathered and understood what the barriers and obstacles really were, this 19% had a ton of meaning to people. And the folks on the community advisory board, the state of play, the way Aspen does it, they ask you to give yourselves a grade. And they were like, we need to give ourselves a D or an F. Like, we're failing kids. And so that conversation, to be able to put this number in front of them and have them own it and feel like it was something that they had come to understand with us, meant that then the word about this problem spread in a very different way than it ever had from this Washington Healthy Youth Survey that is on a server somewhere, and a lot of researchers use it, but it hadn't made its way to the public domain. I think that's a good example of the co-construction piece. Another one, in terms of crafting solutions, we were asked to come up with sort of one big solution, and the one that the committee came up with was that we wanted to empower schools to be the change agents for physical activity. As you all know, being involved in this work, that's where the kids are. That's the best place to get them to be physically active. They're there for much of their day, and if they're not moving, it's going to be really hard for them to get physical activity elsewhere. And one of the things that we named in a list of potential ways we could empower schools was to require statewide standards on recess. So that was back in 2019. It was a piece of the report. Obviously, we eventually revisited it, but it was shared. That had been built together with community. lastly, this is just an interesting story in terms of like the data. I never really had thought about the possibility that the data could be used for emergent issues, but there aren't a lot of youth sports or youth physical activity watchdogs out there, or folks kind of looking to understand what's happening in the landscape. And so during COVID, for example, we were able to work on some equitable return to play documents to help municipalities and schools open, putting those kids who had been most marginalized from sports first, as opposed to the other way around, which was mostly what was happening during COVID. If you remember, like kids on travel teams were traveling to states that were open to play, and the kids who didn't have access, like, still weren't playing. But we had data of like the Seattle youth field users from our policy analysis that we had done. And then we were able to compare from 2018, when we had collected the data, to 2020, who was playing, and just be able to show that gap, and show that I know you can't read that, but it basically shows that it's mostly select teams that were using the fields, and previously there had been a much broader range of users. So that helped to like push some policies forward. And then this one, oh my gosh, this is too long a story to tell, but the gist of it is there were $42 million in a fund that was a leftover fund from the Seahawks stadium build when the bonds were retired. And Paul Allen and had put into the sort of vote around this this taxpayer measure back in 1997 that if there was any money left over, it would go to youth athletic fields. $42 million, right? We were part of a committee to create a statewide grant program to give that money out to focus on having youth athletic fields in underserved areas. During the legislative session, the legislators thought it would be a great idea to use that money to fund upgrades to minor league baseball stadiums. And they did, sadly. This article that we helped craft, because we had the data that said there are not enough athletic fields for kids, and here's who doesn't have them, and here's what they need, and here's what this money would go to, was part of this article. It didn't make enough of a difference. So, but just to be able to use the data for these emergent issues, I feel like is really powerful, and it makes folks feel like, okay, somebody's like paying attention in this space, and it becomes, I hope, harder to do that next time around. So we'll see. Okay, just so on the research side, I mean, this was all research, but a lot of the work has gone into what's happened since the report's publication on the applied side. But we also have had some publications come out of it right now, just 3. There's a 4th one out for review. And as I was telling these guys, as I wrote that down, I was like, only 3? What am I doing with my time? But it's so hard to like carve out the time. There's so much data there now, and I hope that more can come out of it. This first one here is socioeconomic inequities, youth participation in physical activity and sport, is probably the one that has gotten the most traction. It was actually referenced in a New York Times article a month ago about the inequities in access to youth sport. And it really looked at our youth survey, and in terms of sort of these demographic categories, like something, again, that was relatively known. But I think what we did a little bit uniquely is that we had some measures for affluence, and we used language spoken at home as a proxy for immigrant and refugee status. And I think those were a little bit new to the field in terms of looking at those gaps sort of separately from socioeconomic status, which is the primary one that's been measured. Okay, so then from there, the report was published in October of 2019. As it was getting ready to be published, the folks on the community advisory board were like, well, we're not going to put this report out in the public and not do anything about it. So what are we going to do about it? And we decided to become a coalition. So we started with 25 members of this coalition dedicated to increasing access to youth physical activity through sports, outdoor recreation, and free play. Over COVID, we grew and kept growing until we're now over 100 organizations that are members and are committed to kind of this vision of making King County a place where all kids have the opportunity for movement in their communities on their terms. Right after we launched the coalition, I know some of you may have seen this, the World Health Organization, this Fair Play report that they put up suggested partnerships and cross-sector partnerships in particular as a really important mechanism for increasing physical activity. And so it was a little bit of like, okay, yeah, we're doing a thing that seems like it might work in this space. So it was good validation. I'm just going to tell you a little bit about the coalition. Happy to answer more questions about it. It's cross-sector. These are some different types of organizations that are there, everything from statewide associations to businesses, including all of the pro teams in Seattle, to small sports-based youth development organizations. And part of its power comes from these folks all being able to sit down at the table together. That's just, there's so many different types of organizations. I was showing the primary are nonprofit youth serving, but there's healthcare agencies, government agencies, everything in there. This is kind of the structure that we use. This is a collective action model from Robert Wood Johnson Foundation. We don't call them exactly these things, but it's essentially the University of Washington provides the backbone support. We have a leadership team, and we work in these working groups or action teams to try to make systems change. So we don't do direct programming. We take on the solutions that are in the state of play and try to change the system so that the people directly serving kids have all the conditions that they need to be able to improve direct service and get more kids into their programming. So is our leadership team. They're elected by the coalition. This is just a little bit about, I'm not going to read this all to you, but we have a strategic plan that we're working on. It's just about up, so we'll have to go through another strategic planning exercise. But I think some of our values are relatively unique in terms of being communities of color centered, empowering play at all levels, and trying to disrupt traditional systems. The recess branch of work really fit in here in this goal, raising up play as a central component of healthy child development and a priority in regional policymaking. So from the beginning, that was our desire to make this really to be a policy oriented organization. And then these working groups here, we call them action teams. And here are some of our action teams. The advocacy action team, facilities youth, gender equity. We had a COVID return to play one for a while, and we just launched an outdoor recreation one. The one I'm going to just tell you a little bit about is the advocacy action team. So you saw that little nugget in the report that was recess might be a good idea as a way to sort of make some change. This advocacy action team looked at 10 different possibilities for types of advocacy they could do. Green schoolyards, eliminating fees to play school sports, outdoor education. Like there was a really broad variety. And the team used a rubric to understand which one was most aligned with the coalition's mission and goals. And so that included things like, was it going to address the needs of the kids most disenfranchised from physical activity? Were there going to be any unintended consequences? Like a whole series of questions. And recess is the one that the group landed on. So this was, the State of Play was launched in 2019. The advocacy action team launched in 2020. We chose the advocacy topic in about fall of 2021. And then we had to go back, this is the iterative part, and collect a little bit more data, right? We had some data that we were able to revisit from the State of Play, but we also needed a little bit more so that we could make this push for activating the full coalition and the whole state around this need for recess. And I guess that was one of the other pieces, is that we're a county-wide coalition, but this was a statewide push for legislation. And I mean, probably you have similar things here. I guess, actually, I know that you do. Not maybe Corvallis, but like people on the eastern part of the state don't always like to listen to what the folks in King County think is best for everybody. So that was an important part of us getting a little bit more data to say that we think this is a statewide problem and not just a King County problem. Tried to use a little bit of the same frame here, and I'll tell you just kind of a little bit of a hodgepodge of other research that we did. I'm going to say it's a little bit research light. So this one, I think, Will, you're going to have to help us because I think we need to get this published. We did a statewide, like we did an assessment of what are the physical activity and recess laws in every state in the country, and we have that, and I think it's in publishable format if we could figure out how to do it. So let's follow up on that. So that was one, we were armed with that, like the group had that, and we used that to build our advocacy case and know what was going on out there in the world. We had used in the state of play the WellSat, the Wellness School Assessment Tools. Anybody used that before? It looks at school level wellness policy, school district wellness policies, and it rates them in terms of the ways in which they may or may not be helping leading kids on the right path with regard to like nutrition and physical activity and physical education. So we returned to that. We learned a lot of, this one says, it's pixelated for you, does not address recess, was basically what we found in almost every policy in King County. And then we did a parent survey that asked a series of questions about the amount of recess kids were getting and what was the amount of recess time they thought was right for their child, which was maybe the most important thing because they wanted it to be up in this 40 to 50 minute range, which allowed us to say, yeah, 45, what we had wanted was 45 minutes. And that seemed aligned with what families also wanted. So that was useful. We also did some teacher focus groups as well as a lit review, which is where Dr. Massey comes in. How we met him when you're doing a lit review on recess, like that's what you're looking at. So luckily he lived nearby and then kind of joined us, I think at this point, joined our advocacy team, right? So from there, we were able to compile a set of slides and talking points that legislators could use and that we could use with the public to tell the story about what's the issue and why recess was the solution to this set of issues. And we hooked it primarily on both mental health and physical well-being, and mental health was a major issue in our legislature this year, as it probably was for many state legislatures across the country. What did we do from there? The group this morning was asking me, what did we do? And I wish I had a really good way to tell the story, except we just did the next thing that there was to do. We met every Wednesday morning for almost a year. And our action team was anywhere. Sometimes there would only be 3 people there, up to 12 or 15 people. And everybody just took whatever part that they could. But everybody, I think the most essential piece of it is because of all of the pre-work of both the state of play and the coalition building and the choice for recess, as soon as we were ready to launch into advocacy, we had hundreds of people behind us who had this shared vision and a shared understanding of why recess was important. And so as long as we were able to just keep things moving by, creating social media graphics, by meeting with legislators, by giving public testimony, by making videos, we kind of threw everything at it. And eventually, we also learned a lot. I would say none of us were policy experts. We didn't have a lobbyist. We just used what we had at our disposal to try to tell the story best we could with our legislators. And also we had an incredible sponsor of the bill, Senator Tawana Nobles, who's from Tacoma, and she is a rising star in the state of Washington. And we got lucky and she decided to take up our issue and topic, and she was the right person for the time. I think that was a lot of luck and had a lot to do with why things worked out in the end for us to get the recess bill signed not too long ago, about a month ago. So that was a big victory for us. I was going to finish up by telling you a little bit about a few other ways we're trying to measure the work of the coalition. This is a kind of dangerous one, but so in King County, you can see, let's see how I tell this. In 2018, these are kids not meeting the physical activity standard. And we didn't have as much loss during COVID as the rest of the state, right? Does the coalition have something to do with that? I don't know, but we'll take it. We're still at 19% when the rest of the state went from 24% to 21% meeting the CDC standard. So like, this is the one metric that we know will continue to be measured in the state, and we'll use as like our barometer to see if we're able to actually make the kind of systems change that we hope we can make. In the meantime, we're also just trying to measure the coalition's efficacy. Some just basic baseline measures of like what good collective action has going for it in terms of like shared vision, good communication, an inclusive structure. We're doing relatively well. This is on a scale of 1 to 5. Increasing communication between coalition members is something that we can work on, and being more understandable to our members. It's barely how the coalition operates, barely understandable to me. So we need to work on that for ourselves as well as to our members. Coalitions are hard to explain. They really are, because they don't do direct programming, right? They're like working on at the systems level, and that's just something that's can be just difficult to quantify for people. A few other accomplishments. We've advocated for $4 million in COVID relief funding in King County to the sport and outdoor rec sector, which originally there was $1 million planned for that. So we were able to increase that through public testimony and letters to our council members. We also did this year, which is another kind of interesting activity that intersects with your work. We had placed physical activity coordinators in 6 schools, and those physical activity coordinators were responsible for helping to build capacity within school so that kids could get their 60 minutes. That's an NIH grant, so also have like a big study component of that to see how it's going. We have great pro team collaboration. They are both funding us and using our data to change their own practices in terms of outreach and engagement. And in Seattle, they take up a lot of space in the youth sports sector. So it's nice to have them on board and sort of thinking in a more systemic way than in their sort of high visibility, sound bite, like looks good in a picture sort of way. And then just a few other, things that we're proud of is that a coalition organizations are connecting with one another. In our last survey, over 90% of them said that they've connected with someone else doing work in their space. And that's the kind of capacity building that we want to see that's going to have benefits for kids in the end. So in terms of takeaways, I hope folks got out of this sort of chronological story that the research practice stuff is ongoing and iterative, and whatever our next advocacy item is, we'll have to go back to the drawing board in terms of digging up the state of play data and also doing more research. And that because of that hook of the data and a shared understanding of the challenges and also the solutions, we were able to build a network, and the solutions are in that network, and it's through them that the collective action has been possible. And so I think data has been really, really central to the story, but data without the network isn't going to get us there. And so it's really the combination of the two that I think has had all the power. So thank you.
We're happy to say over.
You can answer some questions too. You were part of it. Yeah.
Thank you so much.
Yeah.
It was really interesting presentation. I'm really curious, when you work these groups, your vision for case disabilities, or was it just diverse?
Sorry, in which part? Like through the coalition? Yeah. So we, members of the coalition who are focused on youth with disabilities, Special Olympics Washington is a member, Seattle Adaptive Sports, and Outdoors for All, which is, I don't know if you know them, but they do incredible work in our area. And so we haven't done any action teams specifically around kids with disabilities, but their work is infused in all of our action teams, and they're part of all of that work. The Special Olympics Washington is like an incredible member, and they have a member on our leadership team, and also she was part of our advocacy team and gave public testimony specifically around the way the recess bill would support kids with intellectual disabilities. So yeah.
I have two questions.
Yes.
First, the idea of increased recess is a very good idea. It enables physical activity, but it doesn't in any way guarantee physical activity.
For sure.
Kids are just as likely to go out, sit down, pull out their cell phones and play with social media. Is there any plan for how to get people to actually move?
Yeah, that's a great question. And we had that conversation a lot in our action team, which is like, how much should we sell the physical activity part of recess? Because you can't guarantee that kids are moving, but there's more likelihood that they're going to be moving if they have recess than if they're sitting inside. So we leaned on that a little bit more. I think some of the work that Will does and programs like Playworks, for example, that are able to bring like an actual structure and sort of help schools and teachers develop good recess practices would kind of be a next level piece of that. And I think the unfortunate part about that is it's a little bit expensive. I don't know. Do you have thoughts about that? Like good practices for encouraging physical activity?
By and large, if you create a space for especially like K-5 children to be active, like generally what we see is
yeah. Oh, yeah. Yeah.
So the data on it shows that recess is the most active part of the school day. It beats out anything else. And I think a lot of studies that will account for 4% of time and 40 to 60% of activity throughout the day. So while some kids might not be active, if you create the right conditions, many will.
Following up on that condition, is anybody looking at alternatives to competitive sports for activities? Because competitive sports has very serious problems.
Absolutely.
Very serious. First of all, nowadays, winning is not nearly as important as making the other team lose. And that's a very negative lesson to teach people. Second, kids who are not athletic are going to be hurt one way or another. Either they're going to be excluded, or if there's some sort of program that forces them to participate, they're going to be resented by the more athletic kids, and they're going to be more demotivated.
Yeah.
And finally, you mentioned how a lot of immigrants are not getting involved. Competition is very big in the American culture, but in a lot of cultures, it's not something you go for. And should we really be teaching kids competition to this? I mean, it would make much more sense to have the kids competing against themselves. Say, I'll make sure you do better than yesterday. That way you don't have losers. Anytime you have competitive sports, you've got losers.
Yeah, absolutely. I mean, I think you hit the nail on the head with a lot of the issues. I was just going to go back to our values, which are, one of them is the disruption of traditional systems, right? And so, I mean, two things about that. When we say that we want more kids to be engaged in youth sports, we want more kids to be engaged in high quality youth sports, which don't do a lot of the things that you're talking about, but there are too many programs that actually do the things you're talking about and do harm to kids. So part of this story is trying to improve the youth sports system overall and create other mechanisms by which kids can be active that are not about competitive sports. And it was super important. One of the reasons that our state of play is a little different from the others is that it was really big to our advisory board that we defined it more broadly. We defined play more broadly. So ours is not just about youth sports. It's about outdoor recreation, and it's about free play. And it's more so about being able to move joyfully in your community on your terms, and whatever way that's defined by a community and by a kid. And so we're trying to be more expansive because of that. Yeah, thank you. Who's gonna go first?
You mentioned the importance of the advisory board and the community that what you discussed. Can you tell us a little bit about how you formed that?
Yeah, I will. Thank you. I realized it. So the question was, how did we initially form the advisory board? And we basically put out a call to the community partners that we already had as part of the center, and took about 6 months to build the advisory board based on nomination. So we asked people to nominate other people for the advisory board, knowing that it was going to be a year-long monthly commitment of about 2 to 3 hours. And so I think we got about 50 nominations, and were able to kind of look across sectors and sort of choose a group that represented a really broad range of kind of the mix that you see in the coalition, and ask them to be a part of it. At the time, one thing I would have done differently is I would have stipended those people. We didn't have the money to do that at the time. Now, one thing I didn't mention is that coalition membership is on a sliding scale. So it's pay what you can, or ask to be funded to participate. So we have organizations who get funded to be able to come to the coalition meetings, but we weren't able to do that at the time. Yeah.
Thanks. So I love federal funding. I'm becoming increasingly more interested in alternative funding mechanisms. And so the protein piece that you had on there is very interesting to me. And I can imagine that location has something to do with it. And I keep comment on how those relationships were built.
Yeah. Those relationships are always in flux. But like, as you can imagine, like they saw the story about the minor league stadiums, right? Well, the Mariners, weren't absent in that conversation. And so I won't get into my feelings about the pro teams, but so, that happened. $25 million was taken from this pot of money of $42 million. And then like last week, the Mariners and the MLB announced this exciting investment of $2 million to renovate fields in Seattle as part of the All-Star game, right? Which just to me is just an example of sort of the systemic issues where they're going to make this big splash with these 2 million, and with the other hand, they just stole 25 million. So sorry, that's not really answering your question, which I didn't repeat for the audience, which is how do we work with pro teams? And carefully, I guess that's the answer, carefully. But I mean, we've worked really hard to bring them to the table. At the very beginning of this process, we sat them all down, got them all in a meeting room, which I didn't realize until we were in the meeting. And they said they had never all been in a room together to have a conversation. And so much of this is just like having a space that actually is something for people to come together around. And they developed a shared understanding that play equity is important to them because they need fans, and their fans come from people who play their sports. And if you don't have like basic fundamental physical literacy, you're not going to play a sport. So they could see that the basic need for increasing physical activity was important to them. So that was the very first step. And then from there, it's been just like kind of a constant weaving of like getting them to commit to some collaborative things that don't conflict with the visibility that they want to have around their own initiatives. So for example, the Mariners, again, they do a Hometown 9 program where they fund 9 kids a year from 8th grade through high school to play baseball and softball. And it's a great program. It's not systemic. Like it's not going to solve the problems in baseball and softball. And so 3 years later, they're like, okay, we like this program, but we get it now. Like we need to do something that's a bigger investment that's going to impact more kids. And so they kind of came back to us with that. So I don't know, that doesn't really answer your question, but it's just been a dance and lots of conversations and trying to get people in a room to talk about what our common vision, our common needs, or our common commitments might be. Is that?
Yeah.
Okay. I mean, I would think here we haven't been as good about engaging the University of Washington, which is a little bit of a problem because we're in the University of Washington. but slowly and steadily we're making some inroads with those coaches and those programs and like starting to bring them to the table. And I wonder if here, I don't know what the relationship is with them. And, you know, we have the same challenge about like, well, they're part of the system that's working for them. So how helpful are they going to be in disrupting, you know, problematic system? Yeah, great.
Read it really loud. Where does creative movement play in performance arts fit into the equity model?
Yeah. Yeah, I mean, as I said, like it's really important to us that this is defined as also replay, and that this is really about movement in any way that a kid wants to be able to move. And so much of the problem we're trying to solve is that in Seattle and King County, kids just can't be active in their own communities, right? There isn't the space for it. Like the space that they would have to play is taken up by the select team that's traveling from, you know, across town to come and use the space. And so it's at the heart of it. I mean, just less performance arts, less the arts, but more like this idea that folks should be able to move and play in the ways that they want to is at the heart of what we're trying to do. And it's really about, that part's really about land use in some ways. And it's really about like housing patterns. And there's like so many other systems connected to it. But they're all on the table for reform in terms of being able to create spaces where communities can thrive and be physically active.
What recommendations do you have for future researchers to be actively, like proactively supporting, bridging that research to practice gap?
Gosh.
Their research that they're going to do?
Yeah, it's a really good question. I guess my first would be like push back on anyone who tells you that's not important. Which people I think are going to tell you. I mean, so it goes back to what we're saying, like how I'm sort of outside this incentive system. So I know for a lot of my colleagues, they might want to do what I do, but they're not able to. And so they might be the ones advising PhD students. And so they just have a different vision of what's possible. And so I would just say like a lot more is possible than what academia will tell you is possible. I don't know. Maybe that's a bad thing to be saying here, but so that's one. And like write it into the plan. We were talking a little before, like write it into the grant funding, write it into the dissertation, you know, plan. Like what's the follow-on action? Like what's going to happen because of, and maybe you can't do it all, but maybe you can just set a marker for something that happens when the research is over. That's like a first step. Yeah.
So I would just comment that there is a new strategic plan for our campus.
Mm-hmm.
And as I read pieces of it, nothing out, so it's just pieces that I've been involved in. So I'm talking about the new strategic plan for our university, SP 5.0. And it's not out and there's nothing we can all look at, but I've seen pieces that in various meetings I've been in, mainly focused on research, but other pieces as well. And a lot of the wording now says solution-based research solution. And in our effort to come up with what we call them exemplars to be considered, it's a lot about translational work and taking research to practice and making a difference in the lives of Oregonians. So, you know, I think in my experience, we're moving the dial, and it's a slow dial to move, but I think we're going forward there. So I think we just keep doing the work we do. And for those of you, you should start thinking about moving that dial and taking the work and translating it and moving research to practice. It's terribly important. That's just my biased opinion.
I agree. Awesome. I love it.
Yeah.
Good question. I'm interested in top down versus bottom up approaches to like social change. And correct me if I'm wrong, I perceive this like story you're, I don't know, or maybe you feel like it's a combination.
I think it's a little bit of a combination. Because I would say truly bottom up would have been like folks doing work in community would have said like, let's do this report to understand like what the needs are. And I think it's really, I think the reason why it was a combination and why the combination is important is because the folks who are like on the ground doing the important work day to day, like they don't have the time to like, right, come out of that and say, I want to do this big thing to solve the problem for everyone, even though solving the problem for everyone would help them. And so it sort of takes somebody who has a little bit of distance to be able to say like, hey, I think maybe together, yeah, we could solve this problem. Yeah. Does that?
I'm interested in like how to close that gap.
Mm-hmm.
So if you're in the middle of that gap, how do we get more people like you to bridge that like a bottom up, top down gap so that's the solution?
Yeah, and I can't remember if you were in the room this morning. We were talking about there's this group, the Coalitions for Sport Equity. So I think this model of like an intermediary or a backbone, like I think that is happening in a lot of different public health arenas, like this collective action model that there's this backbone entity or the intermediary that's serving as that broker between the folks who are both doing the work and sort of closest to the problems at hand and this then bridging that to the systemic solutions. So I think like collective action work, coalition building, like I think there's a real need for more of that in all public health domains. And I would say particularly in this one, because there's no department of physical activity. There's no department of youth sports. There's no center of this. And so like we have to create a center for then everybody to come together around to then do that systems level work.
You think once you're done with Boston, we'll go back.
I have thought of running for public office. It is true. Maybe. Yeah. I mean, first I want to rewrite the safe sport federal legislation and then help states create state level legislation for youth sports. And then maybe I'll run for office. I'll be like, 80 years old. But Nancy Pelosi, and so it should be fine. I don't know. Yeah. I have a lot of policy level things I'd love to do, and I'm not sure the best way to do it. Sometimes I feel like the good thing about being in academia is like nobody, I can kind of do whatever I want. I don't know, I'm not beholden to anyone. And when you're a politician, you are beholden to a lot of people. So it's kind of nice being a little bit of an outsider to push change in that way.
One more. Yeah.
Well, so I don't think Oregon has any recess policy. Is that true? And they were definitely on your list of ones that you looked at. And then talking with legislators, maybe, I don't know how many years ago, they had something where they're like, we want people to get this much recess. Legislators thought that's happening. And then they said in their 10-year goal, we're going to have this. And so talking to them in year 9, again, legislate this, and I don't know how many years ago, but they're like, it just kind of fell off the bandwagon.
Yeah.
But do you think that there's some kind of model that you have built that potentially could transfer to others?
I think so. I mean, I think that our advocacy team wants to take the work that we did and like be able to package it in a way, because we also learned from other states. We learned from Arizona and Minnesota, maybe. Was that right? Yes. Illinois. Yeah, Illinois. That was right. So, and the head of our action team, Linnea Westerlin, was in all of these conversations on Facebook with these sort of statewide advocacy groups. And there's a learning space, like a shared learning space there. And so I would say anyone from Oregon who is interested should join that group and learn what other states have done. And I think the model is pretty similar, which is you get like a small group that's really passionate about it, and then they make the network bigger and bigger and bigger. Yeah. Recess bill failed 3 times in Washington before this one. Yeah. So it's something we weren't involved in those, but it sometimes takes a while. Yeah. Thank you. Thanks, everybody.